Banjul Declaration, as it was then called, has been succeeded by the Abuja Action Plan of 2009, which also set January 2015 as the commencement date for monetary union within the zone. As we approach the deadline, we need to reassess the status of the project.
The actualization of a single currency in the West African sub-region is by far not among those things achievable by lip service. As such, Koli, the host governor, spoke of several requirements which require redress regarding the attainment of a single currency.
As we progress in our economic integration process, it is quite important that we harmonize the macro-institutional environment and monetary policy frameworks of our countries. This requires the implementation of the roadmap. The macro-institutional factors under the roadmap include the legal framework and issues relating to the depth of the financial sector. Harmonization of legal frameworks requires strong political support, a timetable that is realistic, and also it should be consistent with the plans of the central bank.
It appeared that almost every aspect of the gathering is more or less about checks and balances for an effective single currency. The Director General of West African Monetary Institute, Dr. Abuaku Englama, also delved into recent developments of the monetary zone.
Macroeconomic developments and convergence. Mr. Chairman, during 2013, global economic growth remained subdued, averaging 2.6%. A significant deceleration from 3.2% recorded in 2012. The sluggish output growth highlights the persistence of new policy challenges for the advanced as well as the emerging and developing economies. Notwithstanding the slowdown in general economic activities, the pace of growth in the WAMs continued to be strong at 6.7% in this review period.
The conclave has in effect elected the governor of the Central Bank of the Gambia as new chair of the West African Monetary Zone's Committee of Governors, replacing the outgoing chairman, Ghanaian Dr. Henry A.K. Wampa. By the elapse of these and other conclaves of the various monetary institutions of the sub-region, many finance and economic experts are of the view that ECOWAS bloc's long-awaited ambition of a vibrant single currency will be realized. Modou Badian, GRTS News.
A training program for a selected number of doctors from the Gambia and other ECOWAS countries is underway in Banjul. The capacity building program on endoscopic and gastroenterology conditions and their management is jointly organized by Horizon Trust Gambia in partnership with the Health Ministry and the Medical Research Council, with material support from Karl Storr Medical Company in Germany. Samuel Ba reports.
Horizon Trust, the Ministry of Health and Social Welfare and the Medical Research Council is leading the first gastroenterology regional training in Banjul. The training brings together health specialists and trainers from across the world to prepare and update our regional health workers on the principles and practice of digestive and liver diseases with cutting-edge endoscopic skills for the 21st century.
The Gambia has had a few firsts, but we're really happy to be involved in this because digestive diseases, gastroenterological problems are very prevalent here, and the lack of endoscopy facilities has been a huge problem. People would have had to travel to Dakar or the UK. And so having this here not only helps the Gambian people by making sure that we make timely diagnosis, we give timely treatment, which will have a huge impact on the health of the Gambian people.
This regional training, the first of its kind in sub-Saharan Africa, forms part of efforts to arm these doctors with skills to power disorders in digestive ailments, which falls within the core objective of Horizon Trust.
The Trust is very happy to organize and be part of this cause for a number of reasons. First, the training and capacity building for health workers falls within the objectives of the Trust. Secondly, the involvement of ECOWAS participants will motivate the trust in broadening its mandate to complement the work of the Horizons Clinic within the sub-region.
The lack of endoscopic facilities, according to health experts, has been a problem in the Gambia, despite the prevalence of these digestive disorders. Patients seeking medical attention of digestive diseases are sometimes referred to the UK or neighboring Senegal, a situation that may change sooner than later.
The Horizons Trust, which is who made this possible, have formed a partnership with the World Gastroenterology Organization, MRC, Ministry of Health, and together I think the effects of this will have a big impact on the health of the Gambian people.
The Horizons project is a social enterprise and probably the first of its kind in sub-Saharan Africa, contributing to development through health and education. Professor James Ndau gives an overview of Horizons project for West Africa.
Some of us sitting here have been unfortunate enough to witness real pain and suffering of mothers and infants in Africa, but we must redistribute that pain and suffering through investing in social responsibility. That is precisely what Horizons is about. We must redistribute the pain of mothers through better equitable health care and economic empowerment of women throughout sub-Saharan Africa.
The new man at the helm of affairs of the Medical Research Council Banjul office said the council, a key partner in the regional training, remains committed to conducting innovative and relevant research.
This is just to say that for us the research is very important. We consider research a key point for development. And what we want to do is we want to do research that makes a difference. So for us it's extremely important to get research into practice, so what we do make a difference for the population of the Gambia, of Sub-Saharan Africa, of the whole world.
The emphasis for this training is giving the skills to our homegrown and regional doctors, wherever they may be, a move that could only be welcomed by the Health Ministry in their efforts for quality health service delivery.
The Ministry of Health and Social Welfare is very happy to be associated with this important first ever training being held at the MRC grounds here. Perhaps because we have our expert gastroenterologists based at the MRC, and we also have the sophisticated machine in this compound. I'm happy to see our colleagues, our staff from the ministry, the likes of Dr. Samate, whom we are very proud of, and other doctors, Dr. Ja, etc. And we want to welcome all those from the sub-region who have come to join this training.
The event also witnessed the official presentation of endoscopic electronic monitors to the Medical Research Council, courtesy of the Karl Storz Medical Company based in Germany. Samuel Ba, GRTS.
The Gambia National Library has taken delivery of 15 computers from Square Mile, a community development program within a mile of the De Montfort University of Linchester. Batujan Mbai has more on that intervention anchored on strengthening national institutions as well as complementing government's development efforts.
Senior lecturer at the De Montfort University, Leicester, UK, and his partners recently donated 15 computers to the Gambia National Library. Square Mile, which is a community development program within a mile of the University of De Montfort, secured the computers for the National Library. The Director General of the Gambia National Library, Abdouwali Mbaye, heaped praises on Dr. Salah and his partners for the worthy gesture, saying the computers will help boost their services. Mr. Mbaye also commended the government of the Gambia, who has always provided a conducive environment for learning.
He has done the country very proud. And as you see him, this is how unassuming he is. He hates to be called a doctor, but he's a brilliant chap. I have watched him, and I know that he's a very good ambassador of the country. Not only has he done well for the Gambia, he's also concerned about helping the less privileged throughout the world. That's why you have global Hands International.
Julie Fleet from the